Dear friends, welcome you. Today our topic is cardiac electrophysiology and renin-angiotensin system. So at first we have to know what is cardiovascular drugs. Drugs having their activity on heart, blood vessels or used in cardiovascular disorders are called cardiovascular drugs. So cardiac electrophysiology is very much important for knowing cardiovascular system or cardiovascular drugs. So we have to know what is impulse generation. Everybody we aware about ECG system or impulse generation system, that is PQRST process which we have seen in ECG system. So at first we have to know what is impulse generation. In short, there are two types of fibers in our heart muscle. One is non-automatic fiber, another is automatic fiber. So these two types fibers maintain the impulse generation of cardiovascular systems. They generate the impulses for cardiovascular muscles, and cardiovascular muscles maintain their consistency according to the impulses. So systole and diastole is consecutively occurred and maintain the blood supply for human body. Non-automatic fiber are ordinarily working myocardial fiber. They can't generate their impulses of their own, but divided into 5 phases, that is 0 phase, phase 1, phase 2, phase 3 and phase 4. This generation is started from minus 90 millivolt negative inside to overshoot plus 30 millivolt, and then the plateau phase is carried out. After that, decline phase is phase 3 and phase 4 is maintained phase. But in case of automatic fiber, there are some specialized conducting tissue are there. They present in specialized part of the heart, that is sinoarterial node, arterioventricular node and his Purkinje fiber. And according to the impulse generation, systole, diastole are occurred and blood supply are occurred throughout the body. So then the next point is renin-angiotensin system. The renin-angiotensin system is very much important for cardiovascular system. Renin-angiotensin system is responsible for blood circulation and blood pressure maintained in our physiological system or circulative system. Renin-angiotensin system is a consecutive process of blood or blood plasma or circulative system. Some pressure agent or some pressure providing agent present in our blood or plasma system, which provided some amount of pressure to the vessel of the artery or vein, venule or cardiovascular system. They maintain the pressure, some amount of pressure to the vessels and maintain the pressure homeostasis of human body. So first of all, angiotensinogen is very much important, which is a plasma alpha 2 globulin which present in circulating system. This angiotensinogen converted into angiotensin 1, which is a decapeptide. This decapeptide next converted into angiotensin 2 by converting enzyme kinase 2. This is present in vascular endothelium. Then angiotensin 2, this is a octapeptide. This octapeptide is responsible for vasoconstriction. This vasoconstriction is occurred by sodium and water retention in kidney, aldosterone secretion in kidney, and angiotensin 2 then converted into angiotensin 3, which is heptapeptide. This heptapeptide is then converted into inactive fragment by angiotensinase. So this is clear from our discussion that angiotensin 2 is responsible for vasoconstriction, sodium and water retention from kidney, and aldosterone secretion. So main ingredients for pressure providing in our circulating system is angiotensin 2. So our motto is, when hypertension is occurred to individuals, to stop angiotensin 2 by any way, either stopping angiotensin 1 or stopping angiotensin 2, or both stopping angiotensin 1 or 2, so that the hypertension can be minimized or maintained. Now I have to discuss about AC inhibitor drugs, that is angiotensin converting enzyme drugs, which inhibit the angiotensin converting enzyme. Are important drugs are captopril, enalapril, lisinopril, prindopril, fasinopril, ramipril are important of its kind. But very common is captopril, enalapril and lisinopril. So maximum of these drugs are prodrug in nature, that is, first when taken orally they converted into an active metabolite and then provide the action. In case of captopril, it is a sulfhydryl containing dipeptide surrogate of proline, which abolishes the pressure action of angiotensin 1 but not that of angiotensin 2. Does not block angiotensin 2 receptor. About 70% of orally administered captopril is absorbed. Presence of food in stomach reduces its bioavailability. Penetration in brain is poor for captopril, and the T-half is 2 hours, but its action prolonged 6 to 12 hours. And in case of lisinopril, it is not a prodrug, so its active metabolite is not required for its activity. So apart from angiotensin converting enzyme inhibitor, another important drug is angiotensin receptor blocker. So in some cases receptor blocker is more important or more efficacious for cardiovascular patient for maintaining hypertension or cardiovascular diseases, because receptor blocking is more efficient than enzyme blocking. So receptor blocking block the cause from receptor side or target the receptor so that the pressure can be maintained efficiently than enzyme blocking. So important angiotensin receptor blockers are losartan, telmisartan, valsartan, irbesartan is nowadays very much popular. So losartan is nowadays very much popular, and telmisartan is also very much popular. Both drug block angiotensin 1 receptor. In case of losartan, It comparatively antagonist and inverse agonist of angiotensin 2 thousand times more selective than for angiotensin 1 than angiotensin 2 receptor. Does not block any other receptor or ion channel. So thank you all. We will discuss other important drugs and various problems of cardiovascular system in our next episode. Up to that, thank you all. Thank you.